Welcome back, where we have a return guest with us today, Sandy De La Cruz, and she is with Harvard Hearing, which is just very close by over here, right over by the mall area. And I'm going to ask about your designation here, because I haven't seen these letters after somebody's name before, NB-HIS.
It's National Board Certified Hearing Instrument Specialist.
Oh, okay.
Yeah.
Very good. And of course, that's what you're here to talk about today. And you sent us along some slides that we're going to take a look at here. And there's so many different brands of hearing aids and types and what they can do. And that's what we're going to talk about today.
Yes, definitely.
So let's look at the first slide. And I'm surprised to learn 48 million Americans have hearing loss.
Yes, it's the third most common condition in America. You know, first is hypertension, and then you have hypertension is the first one, and third is actually hearing loss. 1 out of 3 Americans from age 60 and up have hearing loss. 1 out of 5 teenagers have some form of hearing loss.
I wonder why.
Yes. And then 1 out of 3 baby boomers also have some form of hearing loss.
You know, it'd be an interesting study.
Yeah.
Because teenagers text more now than they're on the phone. Maybe there'll be less hearing loss as we go forward with teens. We'll see about that.
Probably.
But when you speak of hearing loss, we all, I think everyone knows that as you age, whether you're 30 or 40 or 50, there's like, you may not be hearing the same frequencies. Do you count that as hearing loss, or do
Yes,
you count? Okay.
We do count that as hearing loss. Like some people who are exposed more to noise, if you notice now on your cell phones, Apple or your Android phones now have a note that if you go beyond this level, it might cause some hearing loss, because those are noise-induced hearing loss. So that affects a certain kind of frequency.
Okay, so here is a great graphic here, inner ear anatomy and function. And I think this is really good because we can clearly see all the different areas. I'm going to let you explain them, obviously.
Yeah, so basically sound is being collected by our pinna right there. And if you notice, some people, when you do like that, you feel like, oh, I can hear better.
Yeah.
Because you're actually reinforcing a natural amplification by your pinna. And sound travels to the middle ear right there. And you have your 3 bones, which is your hammer, incus, and stapes right there.
Okay.
And then you have your semicircular canals, which is in charge for your balance. Now, a lot of people think, oh, I'm getting dizzy. This might be something wrong with my eyeglass prescription. Actually, only 10% is based on your eyes, and most of them are from your ears. And then you have your cochlea, which is really your organ for hearing, and then it travels to the auditory cortex for processing.
Yeah, and quite often people will say when they have a very severe cold or stuffed up, I feel a little dizzy, especially lightheaded or something like that.
Yes, I'll explain that, because this is the eustachian tube right there.
Okay.
That's connected to our nose. It actually, its job is to equalize the pressure in your middle ear and the outer ear. So if you're flying or if you have a cold, you feel like you're stuffed up and you feel like you're a little dizzy. So because the eustachian tube is not functioning well.
I'm going to take you off track just a minute here of a question that I have. That you know, you fly, your ears get pop and all that, and you get off the plane, and you know it's like you're in a fog. You can't hear very well. I've done this. It's probably totally wrong. You know, where you go like this, you put your fingers on your nose and you blow out your ears a little bit. That's probably wrong, right?
A lot of people think that's how the way to do it, but you have to actually pinch and swallow.
Really?
Yes, to activate the eustachian tube movement. You pinch and you swallow.
And you do that a few times?
Yes, that's called the Valsalva maneuver. Yeah.
Okay, that's good to know. So I've been doing it wrong.
My dad's an ENT, so that's why he told me do that.
All right, so we're going to move on here. We're going to talk about the different types of hearing loss. And there's all different kinds that are out there. And if we go to the next slide, conductive loss.
Yeah, so the conductive loss is mostly medically or surgically treated, or you know, you have wax buildup, you have ear infections, you have fluid in the ear. You know, we had a seminar last night. Great question by one of my patients is, if you have a hearing loss, does it come back? If you have conductive hearing loss, it is treatable.
Okay, and some of these we obviously know, excessive wax buildup. Again, getting wax out of your ear, the safest way?
Safest way really to tell you honestly is that don't use a Q-tip.
Okay.
You know, wrap your pinky with a clean cloth and just try to clean your ears, because really your ears naturally cleans that earwax out. If you
Okay.
push that deeper, it goes into a bony part of the ear that it can't push it out anymore naturally. So
Okay.
it gets stuck there.
All right, and the next type of hearing loss, since I'm going to let you pronounce it,
It's
I'm not even try.
It's a sensorineural hearing loss.
Okay.
Basically, it's a condition where it affects the nerve and the processing system of our hearing. So again, noise-induced loss,
Okay.
age, medications. Now, if you go to the internet, there's a whole long list of what medications do cause some hearing loss.
Okay.
Some genetic conditions, medical pathology also.
Medications that cause hearing loss, is that temporary? If you go off, let's say you're on a medication for something, you know, you don't need to stay on it for years, but you're on it for a certain amount of time, will your hearing come back then? Or how
Some
does-
have temporary changes
Okay.
and some have permanent changes. So,
okay.
yeah, online you will see a long list. Like aspirin actually has some ototoxic or has some, it can cause some hearing loss, but once you're off it.
Okay, that's good to know. So we're going to go to hearing aid options, and I know there is just a plethora of
Yes,
them, right?
yes.
And you've got a little model here
Yes.
that we can see. And I know some of these are just amazingly small,
This
where you
small.
don't even know
Yeah.
that it's in. And then others that I've seen, people wear them almost to say, yes, you know, I'm wearing something, and they're colorful and they wrap around the ear and they can get all different colors and things like that, almost like a Bluetooth device. I know some of them
Yeah.
actually are. So let's go to the next one, what to expect when someone sees you.
Oh, yes, definitely, because there's a lot, as you said, there's a lot of options with regards to hearing aids. It's not just getting them at a store and said, oh, let me try this might help me. We go through a series of evaluation process. We take a look at your hearing loss, not only the level, but the frequency. Is it low or high tones? And then we also take a look at your lifestyle, because then we will be able to actually properly find the right technology for you. Do you need a lot of noise reduction? Do you just need a Bluetooth system? Do you need a lot of the features or not?
Yeah, and I know several people that the main thing for them is focusing on exactly what's going on. The person they're speaking to, watching television or something like that, where
Right.
all the ambient noise, where I think if you don't have quite that problem, you can almost like tune it out and hone your hearing, but they have more difficulty doing that.
Correct. And the current hearing aids now have that option that you can actually control where the microphone focuses.
Yeah, that's nice. So let's go on to the next slide. Hearing aids improve all aspects of life, and I would say that's definitely true, right?
Yeah, yeah. You know, hearing loss is an issue that you can easily go around with. You know, turn up the TV or speak a little
Yeah.
louder, I can hear you better. And then you don't see the aftermath of things where
Right.
you lose touch with people because you can't communicate with them
Yeah.
because you don't want to say the wrong thing in a conversation.
Right, and you're always going, what can you say that again? Or-
Exactly.
So the next slide really shows some of the very different types of hearing aids.
Yeah.
And again, some of them are totally inside the ear. Others, people wear behind the ear, and I've seen them where they come in, you know, just all kinds of bright colors, and they actually look kind of nice.
Yeah, and truly, this is where the assessment is important. Then we want to determine what the right type of hearing aid is.
Yeah, and are there really major differences in the different brands? Because I imagine there's several different brands.
Yes, every brand has their own specialized hearing aids.
Okay.
Like Invisible Hearing Aid, we go with a type of brand there, which is we have Starkey as
Okay.
one of the makers of that. They were actually the makers of Reagan's hearing aid.
Oh, really? Okay. And these are other ones are the Halo brand. I guess that's a brand name. We now have hearing aids that can connect to your iPhone. I would assume Android phones as well. There's probably apps,
Yep.
but
It has
you can control
Bluetooth,
them.
you can control the volume, you can actually stream. So if someone calls you, it will just stream into your hearing aid directly.
That's nice. And here's all the different things that is TrueLink is the app
The app.
that you would find. Okay.
Yes. And then as you can see, it says Find My Hearing Aids.
Oh, that's nice.
It can actually plot where you actually left your hearing aids in a map, or
That is
if you left
great.
it in a room, it'll go closer or further. So one of my patients actually used this for hide and seek with his grandchildren.
That is really nice. And of course, the next slide is going to show you, Google has this online
thing.
as well. And when you get one of these compatible hearing aids, Sandy can help you out. And if you're not used to how to download the apps, whether it's on Google Play or on for the iPhone or iPad or whatever it may be, she can help you out with that. But this is really nice because whether you have one of the Apple devices or one of the Android devices, there's probably one of these things, one of these apps that can help you out.
Yes, definitely.
Very good. So, I encourage you that if you think you might have a little hearing loss, or maybe somebody is telling you that you might have that, to give Harvard Earring a call, because as you can see, Sandy is really great at this, and you know this field quite well.
Yes, I've been in the industry for about 10 years.
Yeah,
So.
very good. Number is 949-900-5239, harvardhearing.com. And one size does not fit all. She's got the little one, though. That's really teeny tiny. I'm going to hold this up. Can you see that? I don't know if you can or not.
Oh, there you go.
Yeah, here we go. There you go. Look at that. That is teeny tiny. Very good. All right. Thank you very much. It's always good to see you.
It's a pleasure.
We'll see you again soon, and you have a good weekend.
Thank you so much.
All right, we'll be right back.